I'm starting with a 360 degree of the room. My name is Chika Nezianya. This is This is a cardiac and abdominal assessment. So for my patient's vital signs, her blood pressure is 167/100, which is elevated. Her heart rate is 105 beats per minute, which is elevated. Her temperature is 37, which is normal, within normal limits, and her breaths. Breath per minute is 20, which is within normal limits. So I am going to keep monitoring. Because of these abnormal findings, she already has a cardiac history. She has reported chest pain. She has reported epigastric pain. Because of this, I am probably expecting maybe or fearing a cardiac event. So for that, I'm going to keep monitoring her vital signs. I'm going to report any abnormal findings, and I'm going to keep her resting. So to start off with, I am going to have an inspection of my client. So my client does not make use of any accessory muscles to breathe. Her work of breathing is normal. My client appears to be fatigued and in pain. So her color is within her ethnicity. There is no signs of distress. Maybe some little signs of pain because of the chest pain and epigastric pain. And also there is no cyanosis. Her color is within her ethnicity. And that is what I can see from looking at my client. And then to move on further, I'm going to inspect for jugular vein distension. Can you turn to that side? So I have inspected, and there is no obvious jugular vein distension on my client. And after that, I am going to be inspecting this area, her cardiac area, and I'm lifting up her top. Having checked, I can see that there are no lesions, there are no marks or anything. And to move on further, I am going to be auscultating. I'm going to be checking for S1 and S2. S1 is loudest at the top and S2 is loudest at the base. First of all, I am going to use my diaphragm first, and I'm going to go to the left intercostal space, and I'm going to listen to the aortic. Yeah, S1, S2, locked up, present. I am going to go to I started at the right second intercostal space for the aortic, and there is S1 and S2. I am going to the left intercostal space, and I'm listening for the pulmonic. S1 and S2 present. I'm going to I'm going to find the third intercostal space. Yeah, this is the EPS point, S1 and S2 present. I'm going to the tricuspid, which is the fourth intercostal space, S1 and S2 present. I'm going to the mitral, which is the fifth intercostal space, S1 and S2 present. And I'm using the bell, and I'm going to check for, so there are no murmurs found during this auscultation, and I'm using my bell. I'm going to be listening for S2 and S3 and S4. And I'm going to go just the way I went before. I'm going to listen to the aortic, I'm going to listen to the pulmonic, I'm going to listen to the EPS point, I'm going to listen to the tricuspid and the mitral. There is no S3 and S4 present. And after this is done, I am going to check my patient's pulses. So I'm going to start with her carotid. Okay. Yes, my patient has 105 beats per minute, and I'm going to check her radial pulse. I'm going to check her brachial pulse, and I'm going to check them simultaneously. 105 beats per minute. I'm going to check my patient's radial pulse, and I'm going to check them simultaneously. Both are equal, and I'm getting 105 beats per minute. I'm going to check my patient's, can you lift the feet? I'm going to check my patient's dorsalis pedis. 105 beats per minute. And after this is done, I am going to go further to check for edema, because edema could indicate a cardiac issue. So I'm checking my patient's ankles for edema. There is no pitting edema. Her ankles appear normal. And the next one, I'm going to be checking my patient's capillary refill. And by doing that, I'm going to pinch her finger. And I can see that circulation returned in under 3 seconds. So that means capillary refill is good on her fingers. And I'm going to do the same on her toe. And it's the same under 3 seconds, which means the circulation is good in that area also. And after that is done, I am going to now move on to abdominal abdominal assessment of my clients. And to do that, I am going to raise her abdomen and have an inspection. Abdomen appears rounded. There are scars are consistent with her past surgery. The umbilicus is midline. There are no there are no lesions. There are no growths. There are no discolorations, and there are no bumps on her abdomen. And after that is done, I am done inspecting, and now I am going to auscultate. And to do that, I'm going to start at the right upper quadrant, and I'm going to listen for bowel sounds. Bowel sounds are present. I'm going to the right lower quadrant. Bowel sounds are present. I'm going to the left lower quadrant. Bowel sounds are present. I'm going to the left upper quadrant. Bowel sounds are present. And after this is done, now I am going to lightly palpate my client's abdomen. I am going to start here, and I'm going to lightly palpate. If you feel any pain, let me know, okay? Okay? And there is no tenderness. And after that is done, I am going to percuss my patient's abdomen. Okay, so my patient's abdominal inspection shows that all findings are within normal limits for my patient. And so my nursing intervention would be to keep my patient comfortable and resting, and would also be to keep checking her vital signs and quickly report any abnormalities. And also I am going to establish an IV line in preparation for any others that could come in. And I am also expecting a 12-lead ECG for monitoring. Also, I am expecting some tests that would include serial troponin tests also. And I'm going to keep checking on my client, and then expect any further orders from the doctor. Thank you.